Verizon Foundation.
Premier sponsorship for On the Record provided by PSE&G, committed to serving customers, strengthening the business community, and investing in New Jersey's future. With major funding provided by the Fuel Merchants Association of New Jersey and the National Oil Heat Research Alliance, committed to saving energy and the environment. Today's oil heat, intelligent warmth for your home. New Jersey's union masonry industry, building New Jersey green and safe with New Jersey craftsmen and contractors. Industry information at IMIweb.org. And by AT&T. AT&T offers business solutions for small, large, and international businesses across the state. From the nation's fastest 3G mobile broadband service to the latest smartphone, AT&T keeps New Jersey connected. Promotional support provided by New Jersey Business Magazine, the magazine of the New Jersey Business and Industry Association, reporting business news for more than 50 years, reaching over 28,000 businesses statewide.
The debate over health care reform has dominated the domestic agenda in Washington for months. Last weekend, the House of Representatives narrowly passed the first comprehensive health care reform act since Harry Truman started talking about insuring all Americans. It's called the Affordable Health Care for America Act. The vote was 224, 215 against. Here with us to talk about the issue and maybe a couple of other things are two New Jersey congressmen. Democrat Frank Pallone of Long Branch has been actively involved in shaping the bill and voted for it. Republican Leonard Lance of Clinton Township joined his 4 Republican colleagues and 1 Democrat, John Adler, in voting against it. Let me start with you, Congressman Pallone. Is it still as good a bill as it was when you were last here about 3-4 months ago debating William Marino, the president of Horizon Blue Cross Blue Shield of New Jersey?
It's still as good, and it's basically the same bill, Michael, I would say, and basically trying to provide everyone with health insurance for those who don't have it and make it affordable for those who have it but are fearful they may lose it or not be able to get coverage in the future.
Laudable goals, Congressman Lance?
Yeah, absolutely laudable goals, and I think we should try to achieve that. I just don't think that this bill is the way to go about doing that.
Why?
It raises taxes, and this is a very poor business climate, and small businesses create the new jobs in America. There is a medical device tax that's particularly harmful to New Jersey. About $500 billion is taken out of Medicare, and perhaps most important from the perspective of the medical community, no tort reform in the bill.
Let's start with the taxes. On whom does it raise taxes? You say it raises them on medical devices?
Yes.
A sales tax? What kind of a tax?
Yes, on wheelchairs, for example. It's been called a wheelchair tax, but it goes well beyond that. And it's particularly concerning to those of us in New Jersey because New Jersey is the medicine chest of the entire world. And I have the honor, Michael, of representing the congressional district that has more medicine jobs and medical device jobs than any other congressional district in the United States.
Congressman Pallone, we don't hear much about a tax on medical devices as we keep track of this debate. Is there one?
There is, but it's very small. I mean,
who pays it? The ultimate consumer of the device?
Well, I guess you could argue that ultimately, but it actually is on the manufacturer. But I would stress that the main way that we pay for this is a surcharge on individuals who make more than $500,000 or couples that make more than $1 million. So, less than maybe 1% of the population is paying that surcharge. And the others are...
It's a surcharge on the federal income tax?
Yeah, on their federal income tax. And then the other half of it is paid for through savings, if you will, in Medicare and Medicaid that are designed to eliminate fraud and abuse, essentially. But I want to explain that the reason for these revenue raises, if you will, is because essentially by expanding Medicaid to people at a little higher income, maybe from $25,000 to a family of 4 to $30,000. So there's a major expansion of Medicaid to cover people. And then there's also a subsidy, if you will, to help people with their premiums when they buy insurance. So the reason for these additional revenue raisers is because we're making this insurance more affordable by expanding Medicaid and providing a subsidy for people when they buy their insurance.
The bill mandates that Americans have health insurance. And if you choose not to get it and you're an individual, you'll pay a 2.5% of your income penalty. And if you're a business and don't provide it, a business of a certain size, you pay a penalty of 8% of your payroll. Congressman Lance, what do you think about that provision?
I'm opposed to both of those provisions. I don't think we should be moving in that direction, particularly given the state of the American economy now. And regarding the taxation increase on income filers above a certain level, about 40% of that classification are small business men and women, and they are needed to create the new jobs in America, particularly given the fact that we now have an unemployment rate in this country of over 10%.
Are you saying a small business person earning more than, what was it, $1 million a year
for a couple
can't afford to contribute toward the solution of national health care?
I think they contribute now quite mightily, and I do not favor raising taxes on anybody, particularly given the fact that we rely in this country on small businesses to create the new jobs to get out of this recession.
Can health reform be done without raising taxes?
I think it can be done, and I am part of a group of centrist Republicans who have put forth an alternative plan that would permit the purchase of policies across state lines. Fundamental medical malpractice insurance reform, not one iota is contained in this bill, and permitting young people to stay on their parents' policies. I think that the bill that the Congressman supported does contain that, and that is a good provision of the bill, that young people will be able to continue on their parents' policies, I think, to age 26.
27,
so
I think.
That is a good provision, but I do think that legislation should have had medical malpractice insurance reform, and that is one of the reasons, for example, that the New Jersey Medical Society has opposed the bill.
The American Medical Association has supported the bill. The New Jersey Medical Society, of which is an affiliate of the AMA, has opposed the bill. When I talked to a doctor friend of mine last night, he said, do you realize that only 17% of the doctors in America belong to the AMA?
That is correct, and at least 17 or 18 of the state societies already have opposed it, and most important from my perspective, New Jersey society has opposed it.
Frank, why no tort reform in the bill just to try to win some Republican support for this thing? We've been hearing for years about malpractice premium rates being exorbitant.
Well, I think first of all, there is some tort reform. What there isn't is a cap on damages. In other words, when we had a motion to recommit, or the Republican motion to recommit when we finally passed the bill, was a $250,000 cap on damages, and I can't support that, and most members, certainly most Democrats can't, because if a person does get injured, $250,000 is not a lot.
How about $1 million cap on damages?
Well, if it was larger, I would consider it, but that's not what was offered. It was a $250,000. But the main thing I would say is you don't, the tort reform is certainly important, but it really doesn't get to these larger issues of affordability and also covering people.
Even the president, I believe, mentioned tort reform in his speech to Congress.
We do have some, Michael. We do have.
He did mention it, yes.
But let me say, we do have provisions in the bill, though. One is a provision that says that states would have commissions that would have to certify, doctors would have to certify that a lawsuit was not frivolous before it could proceed to court and to a jury trial. And another one that encourages arbitration rather than going to court to a jury trial.
Those are forms of tort reform. Yes.
Not the tort reform that is necessary.
You want a cap on awards?
On punitive damages, not on compensatory damages. Obviously, you should be able to be compensated for any injury that has occurred as the result of malpractice. This is those damages above that, punitive in nature, and I would cap them at a reasonable amount, and if $250,000 is not the reasonable amount, perhaps $500,000. But it is a fact that the leadership on the other side in the House of Representatives really does not want to engage in a meaningful debate on this aspect of health care reform.
Let me get your thought on another Republican proposal. One keeps hearing about it. We've heard about it in the gubernatorial campaign that just finished. Chris Christie said that he would allow out-of-state insurance companies to come into the state of New Jersey and sell policies, and that would create more competition and bring rates down. You're shaking your head.
Well, I mean, the problem with the Republican alternative, and I don't want to stress that because that's not what, ultimately we're going to have, but the problem with the Republican alternative is it doesn't cover enough people. It only covers an additional 3 million Americans, according to the Congressional Budget Office. So we cover 96% with the Democratic bill.
I heard the other day that I heard on the radio, and there's probably so much misinformation flying around on this,
right.
But I heard that 19% of Americans, or maybe it was 19 million people, under this version of the bill do not get covered.
We estimate about 96%. CBO, Congressional Budget Office, estimates 96% of Americans would get coverage under the Democratic proposal. Really, the only people that are left out are the undocumented, okay? The problem with the Republican proposal is, what I explained about trying to cover everyone and provide affordable insurance. It doesn't really change the status quo. And when he talks about going across state lines, I mean, that means like in New Jersey now where you have certain mandated benefits. If you go across state lines, you're not necessarily going to get those benefits. But that doesn't even become relevant once you pass the Democratic bill, because essentially in the Democratic bill you have a basic benefit package that every insurance that's sold has. So, this idea of crossing state lines to get a cheaper plan that doesn't have as many benefits, it just disappears as an issue.
Let me ask you, Leonard, about that basic benefit package, which I read in a summary of the bill, provides for preventive care with no co-pays, mental health coverage, a mandate we have in New Jersey. It mandates, it covers dental care and vision care for kids and provides an option for adults to purchase it at a reasonable rate. Is that standard benefit package a good feature of the Democratic bill?
We should move in that direction, and I, for example, have supported S-CHIP, and there were only maybe 35 of us on the Republican side who supported a continuation of S-CHIP.
The family health insurance plan.
This is for children. For children, right. and we work with states in that regard, and based upon my experience here in our state capital, Trenton, I think it's a good program. But I do think that we've just had a debate in New Jersey regarding purchase of policies across state lines. I think that there can be a formula that would include, for example, mammograms. I don't want the same policies that may exist in a place like Mississippi, but I think there could be a national model that could permit the purchase across state lines. And I was in favor of an alternative put forth by about 30 centrist Republicans. That was different from the Republican alternative on which we voted, and I am convinced that if the leadership on the Democratic side had looked at our centrist alternative, it might be a better way to proceed.
Michael, if I could just mention, you were talking about the mandate. I want everyone to understand that under this Democratic bill, if you will, the reason we have a mandate, the reason we have all these, guaranteed benefits and that, we cover everyone, is because we know that the larger the insurance pool, that essentially brings costs down. And if you cover everyone, then the cost of uncompensated care and people going to the emergency room, which is now being borne by everyone in their insurance who has it, this all disappears. And so there's the very nature of insurance, if you will, it's beneficial to everyone if everyone has it, if everyone, is guaranteed certain benefits, because then they go to a doctor.
Are the insurance companies supporting you or fighting you?
The insurance companies like the fact that everyone has to have insurance. What they don't like is the fact that in this health exchange you can choose private versus a public option, which would be something like Medicare, because they want to sell all the insurance. They don't want to have the public option.
The public option has passed the House. The public option will not pass the United States Senate. And
well, we heard a month ago it would never pass the House.
I wasn't saying that. I thought it might very well pass the House, but I do not think that it will pass the United States Senate.
Is it the real public option that was being talked about 2 or 3 months ago, or is it some kind of we'll provide you with the public option if X, Y, and Z don't happen? Is it a real public option?
Well, in the House version, yes, the public option exists in this health exchange, and you can choose that or you can choose the private plans. The Senate has put forward various alternatives, maybe where a state could opt out of the public option.
Or there's a trigger.
It would be triggered if there isn't enough private insurance available, and one insurer has a monopoly, but we don't know exactly what the Senate's going to do. But the House version has the public option existing as a choice with the private options in the exchange.
I oppose that. I think that if we have the public option as is contained in the House bill, eventually many small businesses would be forced into it. Not right away, but eventually, and then I think ultimately we might go to a single-payer system. I am aware that this bill does not contain a single-payer system, but I am concerned...
What's so wrong with a single-payer system? You sometimes hear even, I guess, the president say, if we were starting from scratch, we might come up with a single-payer system.
That's an excellent question, and it's a matter of philosophy, and there are countries that have a single-payer system. Great Britain and Canada. Our tradition in this country is to have health insurance largely through your employment. And I think that other societies that have a single-payer system have waiting lines for non-emergent procedures.
I've heard that. What about that?
Well, we're not
debating a single-payer system.
I mean, that's not the
But do you think that the systems, the more socialized systems of Europe, provide delayed care?
No, I think a single payer...
You don't think so?
No, I think a single payer is a good option, but I just want to stress that's not what we have here. I want everyone to understand that the public option, the way it's set up in this bill, is a choice, and it creates competition, and I don't agree with Leonard that it will eventually, outweigh and everyone will be in the public option, because I think when people choose insurance, they look at price, they look at what doctors are in their provider network, they decide what benefits they're going to have, and I think all those things will compete. Some people will choose one or the other.
Bill Marino, when he debated you on the show, he said this is going to drive the insurance companies out of business because everybody's going to choose the public option.
But the reason he says that, Michael, is because he knows that the public option doesn't have to make a profit, and he figures inevitably, because it doesn't have to make a profit, it will win out. But people don't just go and buy insurance based on how much it costs. They also look at what doctors are in the network, what benefits, how good. There are a lot of factors that go into play.
I'm adamantly opposed to a single-payer system, and I hope that we do not go to that at any time in the United States, and this is obviously a difference of philosophy. The largest group in the House of Representatives, not a majority, but the largest group of members favor a single-payer system, and there were many members who spoke in favor of that. I am philosophically opposed to a single-payer system, and I think that a public option could ultimately lead to that.
Did you say a majority in the House favor a single-payer system?
A plurality, not an absolute majority, but the largest group in the House favors a single-payer system.
And that would be a liberal Democratic group.
Yes, and it's just a matter of philosophy. And I believe that we can reform the system, and I want to be on record as saying that the system does need reforming. Without going to a public option. A public option has passed the House, and I predict today that it will not pass the United States Senate.
What's the abortion issue doing to this issue in Washington right now?
Well, I think that the intent of everyone, well, I shouldn't say of everyone, but the intent of the majority, Democrat and Republican, is to say that if you want abortion coverage, you would purchase it separately, okay? The problem, though, with the amendment that was adopted last week is that I think that makes it much more difficult for that to happen, because essentially...
What did the amendment say?
The amendment essentially said... It's
Stupak.
confusing, but essentially it says that if you're buying insurance through this health exchange, right, then you can't, and you have a subsidy, which a lot of people will have, then you can't buy insurance that would cover abortion, and you'd have to buy a separate rider outside the exchange. Now, I don't think that's practical. I think, in other words, it's going to be very difficult for somebody to buy either public or private in the exchange and then go outside.
So it's going to end up depriving some women of an opportunity to an abortion. What's your view on this issue?
I voted for the Stupak amendment. It was a bipartisan amendment. Republicans voted for it, and I think this issue of abortion should be separated from the health care issue, and it was the intent of Congressman Stupak and others, including many Democrats, that there not be any federal subsidy regarding the abortion procedure. There can be a purchase of a rider, and incidentally now, before any reform of health care, not many policies are actually used for the abortion procedure. It's usually paid separately. And so I think it's the intent of Congressman Stupak
From where?
From Michigan, a Democrat who voted for the final version of the bill in the House, that there be no federal monies involved.
So if you want abortion coverage, you buy a rider to your policy.
Correct.
But the problem, Michael, is that right now, like when most people go out and buy insurance, if they're buying it on the job or even individually, they're not aware that in order to get the abortion coverage, they have to purchase it separately. So I think a lot of people will buy the policy. It won't include the abortion coverage, and they won't know it until they need the abortion. That's the problem.
I believe, based upon the debates that have occurred in America, everyone will know about this, number one. Number two, the bill would not have passed the House of Representatives except for the passage of the Stupak Amendment.
I want to shift to a couple other things, but just quickly, are we going to have a health care reform act by the end of January?
I believe so, because it may be different from the House version because of the Senate, but I think there's a real feeling that we can't have the status quo, and we need to have a health reform that covers everyone, basically along the lines of what passed the House, maybe with some changes.
Bill Clinton told the House Democrats this week, I read, just do something. If you get something wrong, you can fix it later with an amendment. Will there be a bill, do you think, on the President's desk sometime in the foreseeable future?
Yes, and I hope that the Senate will look at what we've tried to do as centrist Republicans in the House, and I predict that the Senate will not pass a public option.
All right, let's talk about two more things in the little bit of time we have left. The big foreign policy question in Washington at the moment is whether to send more troops to Afghanistan, and if so, how many? Let me start with you, Leonard.
I favor a narrowly defined mission in Afghanistan, and I, as a Republican, have not been critical of the President for taking his time to address this situation. Some Republicans have said he already should have made a decision. I am not one of them. I think the President should take his time. I think partisanship should stop at the water's edge. I will try to support what the President suggests. If we increase troops, I hope it is at a measured level, and I hope that the mission is narrowly defined. General McChrystal has said roughly 40,000 more troops. The President is getting more information. I want to support the President, but I do not want an open-ended mission that will end up with 15 or 20 years in Afghanistan.
Congressman Pallone.
I essentially agree with what Leonard said. I think that, we have to understand that Afghanistan was the place where the Taliban and al-Qaeda started and still exist, and there's some evidence that they're getting stronger. And the President's taking his time, and it may be that we have to send additional troops, but a measured response is the way to go.
Let's talk about the new administration taking over in Trenton. Leonard, we should start with you because you're beaming. How does it feel to have a governor again?
It feels wonderful. I endorsed Chris Christie the day he announced. I was active in the primary for his candidacy, active in the general election with environmental groups and other groups. I predict he will be an excellent governor, and I predict he will work in a bipartisan capacity with the Democratic and Republican leadership in the legislature.
Congressman Pallone, you worked pretty hard against him this year.
That's true.
Your feelings now that he's your governor?
Well, obviously, I wanted John Corzine to be reelected, and I think he would have been better. But I think it's very important that we work on a bipartisan basis because, this is going to be a split government. And I worked with that in Congress, too, when we had Democratic majorities and Republican presidents. Very important to work together. The problems that the state faces have to be addressed, and we have to try to work together, Democratic majority in the Assembly and the Senate with a new Republican governor.
I heard a reporter speculate that the Republicans are going to come after you in the 2010 election, if only because you really led the ethics charge on Chris Christie and his alleged use of the U.S. Attorney's Office to help his campaign and the whole deferred prosecution agreement. Do you have to watch your back a little bit extra, you think, in the year ahead?
No, I don't think so. I think that when I run and when all of us run for re-election as congressmen, our constituents re-elect us based on our record and what we've accomplished for them. And I think this Congress is going to be particularly productive, and particularly with the health care reform.
How optimistic are you that Chris Christie can really significantly and tangibly change things in Trenton?
I think it will be difficult, but I think he's the person to attempt that. When he became United States Attorney, he did an excellent job. He proved that in a very difficult position, and I think he will prove it again. But I do not underestimate the difficulties. We have systemic budget problems in this state, and it will take all of those who are in Trenton, and with help, I think, from the citizenry in general, to overcome the difficulties we have.
Do you think he'll have trouble fulfilling all of his campaign promises?
Well, I think that the promises about cutting all the taxes, I mean, at various points he talked about cutting the sales tax, cutting the income tax, cutting corporate taxes. I mean, with an $8 billion deficit right now, I think that's very unrealistic.
All right. Well, you want to predict what tax you'll cut in the final 30 seconds we have? What would he go for first?
I think perhaps the income tax, but not maybe in the first year. And he has said he might not be able to cut taxes in his first year. But over the 4-year period, I believe that there will be some tax cuts.
All right. Leonard Lance, Frank Pallone, thank you both for coming in this week.
Thanks, Michael.
On next week's edition of On the Record, a conversation with 4 legislative leaders to be taped at the New Jersey League of Municipalities Conference in Atlantic City. That's next Sunday morning at 9 and 11 and Monday morning at 6:30. For more on New Jersey politics and government, you can watch Reporters Roundtable Sunday mornings at 10 and Friday nights at 7. Both programs are available throughout the week at our website, njn.net. And thanks for watching.
Premier sponsorship for On the Record provided by PSE&G, committed to serving customers, strengthening the business community, and investing in New Jersey's future. With major funding provided by the Fuel Merchants Association of New Jersey and the National Oil Heat Research Alliance, committed to saving energy and the environment. Today's oil heat, intelligent warmth for your home. New Jersey's union masonry industry, building New Jersey green and safe with New Jersey craftsmen and contractors. Industry information at IMIweb.org. And by AT&T. AT&T offers business solutions for small, large, and international businesses across the state. From the nation's fastest 3G mobile broadband service to the latest smartphone, AT&T keeps New Jersey connected. Promotional support provided by New Jersey Business Magazine, the magazine of the New Jersey Business and Industry Association, reporting business news for more than 50 years, reaching over 28,000 businesses statewide.